when I was diagnosed with fistula, anal fistula, of course I was very concerned because I knew that some of the treatment and some of the surgery was very extensive, also for my research. And during my further research, I came across this treatment called WAFT. And once I saw the treatment and saw actual treatment done by Dr. Malaw, I became much more comfortable, and I decided that that was the way I needed to go. A little more difficulty there was with my fistula, but after a few days now I already feel comfortable. I'm able to, so, and I'm already up. Yesterday I was up. I think the only thing that gave me a discomfort the first day was a little uncertainty about the form of anesthesia that we went for, a spinal anesthesia, which I'd had before some years back, and that didn't go so well, but everything went well here. There was some
How
pain.
was the spinal this time?
It was okay. There was a little pain from my back the first day, maybe more from my fear, because I'd had severe headaches from my first spinal, but nothing this time. And my pain in that area started when I was recovering from a broken femur, and I spent 1.5 years, twice surgery to make it proper, and I still had to maintain my work, so I was doing a lot of sitting at my in a chair, even though I couldn't really move around because of the broken femur. And I started experiencing a pain in the back, and everybody said, it's just because you're getting used to sitting and all this, and you're not sitting comfortably. But it just expanded, and I could feel like there was a swollen muscle between my legs down by the rectum. And I consulted a friend of mine who's a physiotherapist. Said, what's sitting down there? He says, there's no muscle really. It's not, I don't know. And only to discover that one day I was seeing that there was a lot of blood in my, when I had been to the toilet, and I went to consult the doctor, and they sent me for an MRI scan, and they could see that there was an anal fistula that had developed.
Okay.
So.
So what all treatment they have done there?
They've not done any treatment. They say when it becomes too uncomfortable, then we'll look at what options to do. But at that time, the fistula had not penetrated any outer surface. So it was still an openings that were inside the rectum, in the anal rectum there. And blood was oozing then more than other time, then some pus, but with some padding down there, I was still able to, and it was only now once it had opened out in the outer skin that I decided now it's enough. I had several times where I had high fever and had to take antibiotic, and there was a large amount of pus release, very bad smelling pus release. My wife compared it to what a dead person might smell after a few days. So, but no, of course, I was very concerned with the final results. So I felt that after seeing and studying myself the WAF surgery technique, I thought that would be the right for me.
Perfect.
And I'm happy that I was able to get that opportunity and come to Dr. Bernard and get that treatment started. So, and I hope in 2 months that I'm fully recovered.